Hello. In today's video, we will see the speech entrainment therapy approach. This approach is best used with persons with non-fluent aphasia, such as Broca's, as demonstrated in the video. Enjoy. Well, hello, Mrs. Adams. How are you doing today?
Doing okay.
Great. That's great to hear. Well, I'm glad to see you back. We got the results back from your assessment that we did last week. And after reviewing your scores, I felt that the approach to target the aphasia you have, Broca's aphasia, would be speech entrainment. Now, Broca's aphasia is a type of aphasia that is non-fluent speech, and basically that just means that when you speak, you may speak slowly or at different rates of speed, and you may have long pauses between your words. It may feel very short, chunky, kind of halting speech. And the aphasia, Broca's, that you have also means that you know what you want to say, you just have problems saying it. So the method that I feel would be most appropriate to use with you is a method called speech entrainment. And in this approach, what we do is you will see some words or some phrases or sentences or a little script that we've come up with beforehand, recorded on an electronic device. It could be a phone, it could be a tablet, iPad, computer, whatever is easiest for you. And it will be focused directly on the speaker's lips. And usually the speaker will be a person who has non-fluent aphasia or no aphasia at all. And they'll record the script for you, and then you'll watch the screen and listen to the speaker at the same time. Do you have any questions so far?
No.
Okay, great. Please let me know if you have any questions. Just go ahead and stop me. It's very important that I know you understand exactly what we're talking about and what the method is that you're using, because if you don't understand it and I have you practice it one way, then you're not getting the benefit of the therapy. And we want to make sure that you're getting the best therapy that we can give you. So, like I said, with speech entrainment, it is audio and visual. So the visual portion is just focused on the speaker's mouth, so you can clearly see how each word is formed and said. And we use the headphones to make sure that you get a clear audio recording so you can clearly understand what's being said. So I created a little practice script for you that if someone doesn't know you that well, or it's the first time meeting you, you can practice this little script and say it to them, and it'll give them a good understanding of who you are and that you have aphasia and that it may take you some time to speak, but you have no loss of intelligence. It's just a problem with your speech. So the script that I have written for you, what I'll do is I'll read it to you first so you know what you're going to say, and then I will show you it recorded on the phone, and I'll have you put in the earbuds, and there'll be small pauses after each word, so you'll listen to the word and see it formed, and then you'll say the word. So we hope that it'll be a nice, smooth speech. It may have some pauses in between, but that's okay. We just want to make sure we get it nice and smooth, and you can, say what we want you to say in the script. So the script that I've written out for you is, "Hi, my name is Sharon. I had a stroke last year. Sometimes it takes me a while to speak. Please be patient. Thank you." Do you have any questions?
No.
Great. Okay. So you know what you're going to say, so now I'm going to open it up on the phone. Why don't you go ahead and put in the earbuds? All right. So I'm going to press play, and I want you to listen and say the script back.
Hi, my name is Sharon. I had a stroke last year. Sometimes it takes me a while to speak. Please be patient with me. Thank you.
Okay, Mrs. Adams, that was a great first try. I just wanted to let you know that as you practice, it'll become easier and easier. We have a saying in our field that practice makes progress, not perfect. We want to remind our patients that it will take time and it will be frustrating, but we want them to keep practicing. So with these scripts and this approach, it can be customizable to you. So if you have an important doctor's appointment coming up, or an important event, or you're going to meet with someone, we can write you a script specifically for that, and we can practice here in speech, and then have you practice at home. And you can have anyone record your scripts for you as long as they don't have aphasia and they are a fluent speaker. I would recommend trying to stick with the same person so that you're familiar with how they form their words. And I would say practice 5 to 10 minutes in the morning, 5 to 10 minutes in the evening, especially if you have an important event coming up. Practice that script of what you want to say either before you go or the day before so that you feel comfortable speaking, and it'll help relieve some of the frustrations. So if you decide to do therapy with us, we will probably meet for maybe 2 45-minute sessions a week. And I did want to let you know that we do have an aphasia group with members who have different forms of aphasia, if you'd be interested in attending that as well. So, do you have any questions for me?
No.
Okay, great. Well, if you do want to proceed and do therapy with us, you can go ahead and have your husband or someone else give us a call, and we can set up a time that we can come see you. So, it was great to see you again, Mrs. Adams.
Thank you.
Great.